we're going to talk about the loading phase of the baseball swing. The loading phase consists of 5 movements. 1, backward movement of the shoulder and arms. 2, backward rotation of the spine. 3, beginning of the timing step. 4, cocking of the hips. And 5, cocking of the wrist. But when we describe the biomechanics, we're going to be looking at it from a right-handed batter's standpoint. Here, adduction of the left shoulder or arm occurs. The prime mover is the pectoralis major, and the assisters are the coracobrachialis, latissimus dorsi, and teres major muscles. The left shoulder ends up slightly shrugged, which is a function of the upper fibers of the trapezius. The left scapula is also protracted or moved anterior toward the front of the body. The contraction of the muscles stretch or load the muscles on the back of the same leading left shoulder, namely the posterior deltoid, rhomboids, and middle fibers of the trapezius. And because the left arm is so severely adducted across the player's body, 2 of the rotator cuff muscles are also undergoing a stretch. Those 2 muscles are the teres minor and infraspinatus. The movement of the back arm away from the pitcher and laterally raised away from the player's body is known as shoulder abduction. This action is caused by the supraspinatus and middle deltoid muscles. The contraction of these muscles stretches or loads the antagonistic or opposing muscles on the same side of the body, namely the latissimus dorsi, teres major, serratus anterior, and pectoralis major. These muscles are now fully loaded and stretched, ready to swing the bat from this position. Backward rotation of the spine. At the same time the shoulders and arms are moving backwards, muscles contract along the spine to help rotate it. The action of the abdomen and chest and upper body all turning away from the pitcher and toward the catcher gives the appearance that the shoulders are rotating backwards with him, when in effect, it is the spine that is rotating, carrying the shoulders with it. This rotation is caused by the external abdominal oblique. Immediately after the spine begins to rotate back towards the catcher, a short timing step with the front left leg begins to occur. Since the center of gravity remains in the same place along the midline, and perhaps more importantly, in front of his back foot, the natural tendency in this position will be to fall forward. This creates momentum at the beginning of the timing step. We load the big muscles on the back of the leg, thigh, and buttocks. The first group of muscles that gets further loaded are the hip extensor muscles, which consist of the gluteus maximus, semimembrananeus, and semitendinosus, and the long head of the bicep femoris. Knee extensors are also loaded, so this would include the quads. The last group that is loaded are the ankle plantar flexors, or calf muscles, which include the gastrocnemius and the soleus.
Now we will begin the launching phase. This starts with the continuation of the timing step. This is where it begins to return back to the ground. This causes the external rotators in the left hip to contract. Next is the opening of the hips. The hips open towards the pitcher when the bat comes in contact with the ball. This causes the external hip rotators of the right hip to contract. Next is the forward rotation of the spine. The whole upper body of the batter twists, causing the lateral rotators of the spine on the right side of the batter's body to contract. These are the external abdominal oblique, the multifundus, and the rotator spinae. The left arm and shoulder will pull on the bat throughout the swing, and the right arm and shoulder will push on the bat handle throughout the swing. Muscles that pull the left arm are the middle fibers of the trapezius, posterior deltoid, and rhomboids. The left arm starts completely adducted, and 2 of the rotator cuff muscles are also stretched, which are the teres minor and the infraspinatus. All 5 of these muscles contract to pull the left arm around. The right arm starts abducted, and the muscles that are stretched here are the latissimus dorsi, teres major, pectoralis major, serratus anterior. The right elbow then drops and stretches the latissimus dorsi and the teres minor. The right arm then applies a short but hard push forward, which brings the bat around. The muscles used here are the pectoralis major, serratus anterior, with help from the anterior deltoids and the coracobrachialis. The bat head is the recipient of all the force created in the body due to the rotation of the hips and spine along the pushing and pulling action of the shoulders and arms. Also, at the same point, the left forearm is pronated and the right forearm is supinated. This occurs at the elbow joint and not at the wrist joint.
The follow-through takes us from the contact point with the ball to the natural ending of the swing. It involves the continuation of all the rotation taking place in the hips and spine, along with the continuation of the pulling and pushing action of the arms on the bat, and it involves a rollover of the forearms. At contact, both hips are open towards the pitcher, and after contact, the hips keep rotating around. The gluteus minimus, gluteus medius, and tensor fasciae latae muscles all cause medial rotation of the hips. The quadriceps extend the front leg at contact. The external abdominal oblique and rotator spinae all rotate the chest and back after contact. The muscles in the lead arm used are the posterior deltoid, rhomboids, middle fibers of trapezius, the infraspinatus, and the teres minor. The muscles used in the left arm are the pectoralis major, serratus anterior, coracobrachialis, and anterior deltoid. The left forearm starts at a supinated position but ends up in a pronated position, and the right forearm starts pronated, ends up supinated. The pronator teres and pronator quadratus pronate the left forearm, while the biceps brachii and supinator muscles supinate the right forearm. This all happens simultaneously, so there is no loss of speed during the swing.